This afternoon, I'll give you an orientation of your urinalysis. So urinalysis is one of the more common lab procedures that we do in the clinic or in the hospital. No? So this afternoon, this should give you a good idea on what a normal urinalysis result would look like. Okay, so your typical urinalysis will be examining for three important properties of the urine. So you have your physical properties, you have your chemical properties, and you also have your microscopic properties of the urine. Okay, so first, of course, you need to collect your urine sample. Now, ideally, you have several ways of collecting your urine sample. The most ideal would be your suprapubic aspiration. No? So this is performed by surgeons. So what you do is you insert a needle into the urinary bladder and then you aspirate your urine sample. So this is said to be the most ideal because it's aseptic and it virtually eliminates contamination. No? Next would be your catheterization. So you insert a Foley catheter, no, through the urethra, and then from there you can actually collect your urine sample. Now these two samples virtually eliminate contamination. So if you perform it properly, then your urine sample is most ideal. Now, because of these methods are a little bit invasive, we do not do them routinely, no? Most especially for outpatient basis. So what we do is the midstream clean catch. So it is important for you to instruct the patient how to properly collect the urine. So the medtechs here are probably more familiar with this. So when you talk about or when you tell your patient to do midstream clean catch, what you essentially do is allow the individual to pee, so void or remove the first few ml, no, from the urine stream, and then you using one hand and holding your cup, you get a urine sample. So you collect, no. So don't pause in between, and then once you have an adequate amount already, you discard the last few ml. So the reason why we get the midstream, it's to minimize contaminants, because your first few ml would contain epithelial cells, no? So that might contaminate your urine sample, and getting the last few ml might not be reflective of what your actual urine is. So that's why we get the midstream clean catch. So that's how we do it for both male and females. So for male patients, medyo convenient siya. It's a little bit convenient or more convenient compared to females, because some females would have to do a little acrobatics para to get a midstream clean catch. And making sure that for females, making sure that the stream of your urine will not be, touching the labia or the skin, because if you get urine sample that will touch these regions, that can also cause contamination, no? So other ways of collecting your urine sample, most especially for pediatric patients, we use the wee bag or the wee bag. So this is just a small bag, no, attached to the genitalia of the patient, and then since infant naman ito or babies, you just allow the infant to pee inside the wee bag. So that's how you collect. So again, you have several ways of collecting your urine sample, but in the outpatient on an outpatient basis, it is important for us to give proper instruction, no, for your midstream clean catch. Now, once you have your sample, you should perform your tests immediately. No? So probably within the hour, you should process your urine sample already, because if you allow it to stand for more than 1 hour, then your urine sample will have, or you could have erroneous results, no? Because bacteria might grow, metabolism of some of the urine components will happen, no, like glucose, etc. So ideally, your urine sample should be processed immediately. Okay, so once you have your urine sample, of course, it is imperative that you label it. No, you write the name, the room number, the date, the time. It's also important. No, and if you want to do other tests that other than your standard urinalysis, like for example, if you want to do let's say drug test, no, for your urine sample, so we could also do that. Okay, so this is not a proper way of handling your urine sample. So always consider this as a biohazard. So make sure you wear your gloves, your container is properly sealed, no? Not like this one. Meron pa siyang spout. So there. Okay. So these are the things that you will be using, no, when examining for your urine. So all of this is written in your manual naman. Okay. So this is your beaker. So this is where you place your urine sample. Essentially in the lab, we use a beaker because since many of the medical students are not yet adept at doing urinalysis, no, the little specimen bottle would not be enough for novice students. For the medtechs, they're more expert at doing this, so you can have a small specimen. But for novice students, probably 150 ml or 200 ml of urine is used. No? So you have your centrifuge, microscope. So this is your urinometer. No? So this determines the specific gravity of your, this determines the specific gravity of your urine. So in the cylinder, you basically fill it around 2/3 or 3/4 of the cylinder with urine. And then you place your urinometer inside and then you twist. No? Then after a while, this is how you read your urinometer. No? So that's your specific gravity. We'll go more. We'll talk more about this later. So this is your refractometer naman. No? Some are digital, like this one. So your refractometers will also determine your specific gravity. So you could place your urine specimen here or your urine specimen there. And then the device will show you the specific gravity of your specimen. So these are the parts, no, of your refractometer. So you take note of that. Pwedeng itanong yan sa exam, yung mga parts. No? These are your reagent strips. So this is also used in the lab in order to determine a few of your chemical properties in the urine. No? So here you have your WBCs, nitrate, urobilinogen, protein, pH, etc. So what you do is you just dip the reagent strip in your sample. Make sure all of your blocks, no, will come in contact with your urine sample, and then you take it out of your specimen. Make sure when you set your reagent strip, it should be horizontal, no, horizontal, not vertical. Because if you set your reagent strip vertically, the urine might drip down and then contaminate the other blocks. No? So make sure you set it horizontally. And as far as reading your parameters are concerned, no, not all, you will not read them at the same time. Some will take, like this one, some will take 60 seconds, some will take 45 seconds, some will take 2 minutes, etc. No? So you take note of that. So you do not read everything at the same time. Okay. So first, let's talk about the physical properties of urine. So namely, these are your color, transparency, odor, and specific gravity. No? So when you talk about color, it's the color of your urine. No? So you simply describe it. If it's clear, if it's light yellow, if it's dark yellow, amber, red, etc. No? Sometimes tea-colored. Now, the color of your urine on the average will reflect or will give you an idea of the hydration status of the individual. Of course, the lighter the color, the more hydrated your individual is, supposedly. No? If the color is, let's say, dark yellow or amber, then medyo dehydrated na yung individual. Now, sometimes the color of the urine can point to pathologic conditions. Like, for example, when you have a tea-colored urine, this usually points out to a glomerular problem. No? Example would be glomerulonephritis. Or if your urine color is red, then bleeding might be happening. No? But sometimes a red color, which usually portends to blood, may be normal, most especially if your patient is a female having her menses at that point. So of course, you'd expect a red urine sample with that. So you need to do a little history taking, no? Making sure that everything is in order before you do your differential diagnosis. So take note that the color of your urine could signal or could point to you a few pathologic conditions. Now, as far as transparency is concerned, so this is described as clear, hazy, slightly turbid, or cloudy. No? I'll teach you later how to identify. Now, as far as odor is concerned, what you do is you just place a sample inside a test tube and then you whiff. No? Medyo iganon nyo lang, paypayan nyo lang. You just whiff the odor, no? And describe it as aromatic, ammoniacal, pungent, or foul. Now, sometimes your urine sample, normally it's aromatic. So yung medyo may konting panghi, kumbaga. So may amoy siya kahit paano. But certain conditions could give you the other odors. Like for example, ammoniacal. So most especially if the patient is taking a lot of proteins, no? Meron siyang protein supplement. So medyo the odor of the urine sample would smell like ammonia. If your patient, most especially among female patients, no, if it smells like yung malansa, no, pungent or foul, parang bagoong. I don't know how. But you know what I mean, how bagoong smells like, no? Smells like parang, I don't know, hirap siyang ma-describe eh. But you know what I mean. So this could point to certain infection, no? Now, the color transparency on odor, a lot of times may be subjective. So this depends on the experience of the medtech, no, or the medical technologist. What is light yellow to you might not be light yellow to me. Things like that. Or what is slightly turbid to you might not be slightly turbid to me. So these are subjective findings, no? Very subjective siya. So it depends on the experience of the medical technologist. Now, lastly, you have specific gravity. So your specific gravity will tell you the relative amount of solutes present in your urine sample. Now, specific gravity is actually a ratio of your specimen to distilled water. No, it's a ratio of your specimen to distilled water. So if your specific gravity is 1, then your specimen is distilled water. Now, the more solutes you have or the more solutes present in your specimen, the specific gravity increases. No? In your urine sample, a specific gravity that is 1.035 could still be normal. But anything beyond that, your urine sample would have a high specific gravity. Probably medyo dehydrated na yung pasyente. No? If you have very high specific gravity, like for example, 1.04 or 1.05 and beyond. No? Okay, so for assessing color and transparency, no, Like for example, if you have this specimen, this is not ideal because if you look at the container, it's a little bit cloudy. So your container ideally should be clear, glass preferably, no? So that you can properly observe for the color. So gaya ng nabanggit ko, color is subjective. It depends on the experience of the individual, no? To the medtechs here, this is probably yellow or light yellow, no? Hindi ako medtech, so light yellow, I guess. No, things like that. Now for transparency, sige, mamaya na yung transparency. So for color, as what we've mentioned, the darker the color, supposedly the more solutes are present in your urine sample. Now, if you're addressing dehydration, you need to take into account the things that the patient is consuming. Like for example, multivitamins are notorious in imparting a dark color sa urine. So you take note of that. If the urinalysis results might not be congruent, like for example, you have a dark urine specimen, a dark yellow urine specimen, but the specific gravity is around 1.01. So that's dilute. So that's incongruent. No, that's incongruent. Typically, a dark urine would have a high specific gravity because high amounts of solute. You might want to ask the patient, are you taking any medications, multivitamins, things like that. No? So there. Now, one tip, when you pee, no? O ito, ano na to, clinical application na to. When you pee and you observe for the color of your urine, a well-hydrated individual would have a colorless or a clear urine or probably light yellow, no? Parang very dilute lemonade, something like that. Now, the darker your urine is, of course, the more dehydrated you are. So you might want to drink water already. Okay. So here are a few examples. No? Okay, so for the transparency, what you do is you place a urine sample in a clear test tube and you put, let's say, a newspaper or any text behind it. So if you are able to read, no, through your specimen, then it's clear. So, syempre, kung medyo cloudy na siya or slightly cloudy, you could barely see the text, no? More so if you have a cloudy specimen. If you're not able to see the text already or if the sample is opaque, then it's turbid, no? Now, usually a turbid specimen would have high amounts of solutes, most especially proteins. So again, if you test it for proteins, it should be positive, more or less. No? So you check for consistencies. Okay, ayan. So this is your urinometer. Again, this determines your specific gravity. So you just fill the cylinder around 2/3 or 3/4 full of urine, and then you place your urinometer inside. The principle here is the buoyancy, no, exerted by the fluid. So the more solutes present in the fluid is, of course, it will exert a greater buoyant force. It will lift your urinometer, no. So from there, you should be able to read the specific gravity. Yeah. So this is how we do it, no. So you place it, you twist it, no? Allow it to spin for a while, and then let it settle. And then this is how you will observe. So here you have specimen A, here you have specimen B. So of course, specimen B would have a higher amount of solute. So it has a higher specific gravity because the buoyancy is higher compared to specimen A. No? So mas lumutang, kumbaga, yung urinometer mo. So because of the high amounts of solute, buoyancy is increased, so that lifts the urinometer and that gives you a higher specific gravity. Yeah. So in reading your urinometer, you get the lower meniscus. So this one, not the upper margin of your fluid. So you're getting the lower meniscus. So this reads around 1.25. No? Yeah. So that's how you read your urinometer or your hydrometer. So this is your refractometer. So this also determines your specific gravity. So you just place your specimen here and then you look through the eyepiece. So this is how it appears, no? So babasahin nyo lang siya. So in this case, it's 1.125. Okay, sige. Yung mga na-disconnect, habol na lang. Okay, so this is how you read your specific gravity using a refractometer. Yeah. So this is your normal, no, specific gravity. So it could be as dilute as 1.003 to as high as 1.030. So if you go beyond 1.030, then you are dehydrated already. No? So you might want to take in lots of water. Okay. So that's the physical properties of your urine. Now let's go to your chemical evaluation. So these are the parameters that are typically determined with your urine sample. No? Your pH, glucose content, protein, ketones. No? Ketones, this is reflective if your patient is on a diet. No? Let's say the patient is doing intermittent fasting, let's say. No? Or I don't know, naka 1,000 calorie a day diet lang siya. So fatty acids are being metabolized, so that increases ketone production. Then that also appears in the urine. So bilirubin is also determined. So this would be coming from the breakdown of your red blood cells. Also your urobilinogen, your VMA or vanil mandelic acid. So this would come from metabolism of your catecholamines, and specific gravity. Now, specific gravity, just like what I've said a while ago, I'm not a medical technologist. Some articles will classify specific gravity as a physical property. Some will say it's part of your chemical evaluation because your specific gravity can also be determined using your dipstick. Okay. So your urine pH is normally 4.5 to 8. So it could be as low as 4.5 and as high as 8. So it could be alkaline. However, the average pH is 5.5 to 6.5. So it's a little bit acidic. So after your lecture this morning on acid-base balance, this should give you an idea why your urine is typically acidic. However, if you get a urine sample that is neutral, let's say 7, or alkaline 8, you might want to investigate further because certain foods can impart an alkaline urine. I'm not sure what these foods are, but what I've heard, like cranberry juice, your grapefruit. I don't know about buko juice, yung coconut milk, if it imparts an alkaline urine. Anyway, things like that. Some foods kasi can give you an alkaline pH, and this could be normal. This could be normal. Otherwise, you might be facing infection, like Proteus infection. Okay. Your Benedict's test will determine if you have sugar present in your urine sample. So what you do is you get 5 ml of Benedict solution. So it looks like this, clear blue. and then you put 5 drops of your urine sample, and then you put that, or you heat that, no? You put that on a burner, so you heat that. So the principle behind is the reduction or the copper reduction of your glucose. So from copper sulfate, magiging cuprous oxide siya. So it becomes cuprous oxide. So that will change the color of your Benedict's solution. So for example, if it becomes like this, colored green, then you label it as trace. If it's yellow, if it's +1, then you have green supernatant with yellow precipitate. +2 is yellow supernatant with yellow precipitate. If it's as yellow as this, no, +3, and if it's like dark yellow or even orange, then it's +4. So that's how you use your Benedict's reagent, no? So the principle behind is the reduction of copper with the presence of or reduction of your copper with sugar using heat. For your proteins, we use the heat and acetic acid test, no? So what we do is get 5 ml of your urine sample, and then place 5 drops of acetic acid, no? So 5 ml of your urine sample, then place 5 drops of acetic acid, and then subject that to heat. So the principle behind is your heat will denature the protein, and the acetic acid will accelerate the denaturation of your proteins. So if proteins are present, then flocculation will happen or will occur. So you report it as negative, no? If you have clear, no cloudiness, no turbidity. So that's negative for protein. So diffuse cloudiness is +1, granular cloudiness is +2, with flocculation, no, +3, and if you have really large flocculations, so that's 4. Okay, so for example, if you have this specimen, no, let's say specimen A, specimen B. So of course, specimen A, since it's darker, it's more cloudy, so you could suppose that it could contain, or it contains more protein compared to specimen B. No? So you need to look for congruencies when you're doing your laboratory parameters. Yeah. So using your reagent strip naman, no? So using your strip, you just dip it, no? And then after a while, take it out and then set it aside. Make sure again you set it horizontally, not vertically, no? In order to prevent contamination. So you set it horizontally, and then take note when to read, no? So you do not read it at the same time. So sometimes some will take 30 seconds, some will take 40, 45, 1 minute, etc. So using your canister, so you have a comparator block there, you just look for the color, and then that will already tell you the amount of, let's say, glucose you have, or your bilirubin, ketone, pH, etc. No? So again, yeah. So for example, you have this standard. So this is your comparator block. You just match. Then sulat niyo lang. You just take note. So ganun lang siya kasimple. Okay. For your microscopic evaluation, these are the things that you will be observing under the microscope. No? So you have your cells, casts, crystals, bacteria, and mucus threads. Now for this one, the more experienced medtechs should be able to do this with ease. No, it takes a little experience because sometimes if you're not properly trained, what you might think as, let's say, a mucus thread could just be an artifact. No, and sometimes if you're inexperienced, you won't be able to catch the bacilli or the cocci present in your specimen. So it takes a little experience in evaluating your urine sample for these parameters. Okay, so for your cells, we check for your white blood cells or your pus cells, RBCs, and epithelial cells. No? For your casts, casts form when certain substances become entrapped within the tubules. So they are cylindrical in shape, no? And depending on what type of substances become entrapped, then that's the kind of cast that you have. So let's say, for example, you have an RBC cast, a WBC cast, a cellular cast, crystal cast, hyaline cast, etc. We'll have that more of that later on. Crystals are also important, no? Yung mga calcium oxalate crystals, urate crystals, etc. So that should give you an idea on some pathologic problems that might arise. So for example, if you're entertaining kidney stones, one of the more common causes of your kidney stones would be your calcium oxalate crystals. No? Bacteria, of course, you need to check if you have bacteria. Sometimes yung yeast pa. If you have yeast infection, you could also see that in the microscope. No? And your mucus threads. Yeah. For your reporting, when you're determining your casts, we usually go low power field. No? So you just count the number of casts that you see and you identify the cast that you see, and then you report that number of casts per low power field. For your cells, we go high power field. No? That's for your WBCs and your red blood cells. And you also take note of the morphology, no, of your cells. So if they occur in clumps, if you have dysmorphism, etc. No? For crystals, you report it like this. So none, few, none, rare, few, moderate, or plenty. The same is true for your bacteria. So these are your qualitative descriptions for the number of your crystals and bacteria. Yeah, so ganun din yung mucus trends. Okay. Quantitatively, this is what they mean. So if you count, let's say, one cell or one cast for high power field, so that's reported as rare. 2 to 5 is few, moderate is 6 to 10, plenty is 11 to 50, and greater than 50 is TNTC, or too numerous to count. Now, clinically, it is important that you take note of the number of, let's say, cells that you have. Like for example, if you're looking at a urinalysis report, and let's say you have few red blood cells, no? Few RBC, 1 to 5, that could be normal. If it goes 6 to 10, it depends on you, no? So would you want to work the person up if you're entertaining for bleeding? So there are many causes of bleeding. One of the more common ones would be stones. So things like that. Or you might want to do conservative management first. You tell your patient, okay, we'll repeat this urinalysis after 7 days or after 10 days. You drink lots of water. If the RBC is still persistently high, then we'll refer you to a nephrologist or what have you. You might want to further investigate. Things like that. No? 11 to 50, and most especially greater than 50, too numerous to count, that should already alert you. No? The same is true for your WBC. Now, typically, a normal WBC count is around less than 5. 6 to 10 is pushing it. Depende sa clinical practice ninyo. For OB patients, no, or OB gynecologic patients, sometimes 6 to 10 you give, some doctors already would give antibiotics even though your patient is asymptomatic, no, because I don't know, females tend to have a greater rate of having UTI compared to males. Of course, that's due to their anatomy. No? So that's why some doctors would already give medications for these patients. Now, sometimes you could also do conservative management muna. Okay? We'll repeat this after, let's say, 5 days or 7 days, drink lots of water. If it's still persistently high, then we go with antibiotics. Things like that. No? So it's up to you. It's up to the clinician actually. So clinical judgment. Of course, if your patient is symptomatic already, let's say your WBC count is let's say 7, and your patient has fever or having tawag ito, lower abdominal pain, then you might want to treat already. No? So you could say the patient is having UTI already. More so if your WBC count is more than 10. So if it's 11 and above, no, up to 50 and more, then you might want to give antibiotics already, even if your patient is not having any symptoms. No? So bigyan niya ng antibiotic. Okay, so these are examples of your casts. So notice that they are cylindrical in shape, no? So what happens is that these substances become trapped, no, inside your tubules. And clinically, these casts can cause obstruction. And when it causes obstruction, no, if it goes up into the more proximal portions of your nephron up to your Bowman space, that could already spell trouble to your kidneys, no? So there. Yeah. So here are your epithelial casts, WBC casts, RBC casts, no, hyaline casts, uric acid crystal casts, no? So you might, if you have these casts, you might want to tell your patient, okay, you need to hydrate more because you need to flush these casts out, no, in order to clear the passage of your tubules. Crystals. So these are the more common crystals seen, no? So of course, depending on the substance, could be your cholesterol crystal, calcium phosphate, calcium oxalate. So your calcium oxalate is the more common crystals found. So they would look like these, no? Yeah, struvite crystals, cystine crystals. Now some crystals, like for example, your struvite may be present when you have an ongoing infection. So these are the properties of your crystals. Some crystals tend to precipitate with low pH, no? Like these ones. Now some tend to precipitate under an alkaline pH like these ones, no? So your triple phosphate or struvite crystals usually, for example, when you have proteus infection, so you could have your triple phosphate or your struvite crystals. And make sure, or one way of checking is you check again for consistencies, no? Like what we've been mentioning since kaninang 3 o'clock, if you have, let's say, a struvite crystal, but then your pH is acidic, that's a little incongruent, things like that, no? Okay, so under the microscope, it could appear like this. So you have your white blood cells, you have your red blood cells here. You could even observe for yeast infection, no? So baka may candidiasis yung ating patient. So this is a mucus thread. So to those of you who are not medtechs like me, I would miss this, no? So I'm not really trained in identifying mucus threads. Baka artifact lang, no? Sa akin yan. And sometimes yung mga objects that I label as mucus threads, when a more experienced medtech would come in, he will just say, oh, that's just an artifact. That's not a mucus thread. Things like that. It takes a little training and experience. Okay, so you also check for bacteria, no? Yan, no? Mga maliliit na yan. Your cocci and then your rods, your bacilla. So again, if you're not trained, no, to identify these organisms, you'll miss it. Okay, so another laboratory procedure that we can do is urine culture. So when a patient comes in and he or she has recurrent UTI, no? Patient comes in, has UTI, you treat it, then after let's say 7 days or 10 days, patient comes back, still has UTI, maybe the antibiotics are not working. So what you could do is you do urine culture. No? So you allow the microorganism to grow. So this is your, let's say, a blood agar plate. So you just inoculate it and you allow it to grow. And your urine culture will identify what type of pathogen you have, no, yung offending organism. And your urine culture and sensitivity will also determine which antibiotic is your specimen susceptible to or resistant to, no? So ayan. Yeah. So ganon. So once you have your report, then you will be able to give the more appropriate antibiotic. Now keep in mind that your urine culture will take some time, no? Typically around up to 3 or 5 days. No, 3 days yung initial report, then probably the official report on the 5th day or on the 7th day, something like that. No, so you allow the bacteria to incubate for a while. So there's no such thing as urine culture stat. No, sometimes some consultants, parang would ask, oh, where's my urine culture report? No, I had that requested last night. Good luck naman. Walang ganon. So give it some time, no? Allow the bacteria to grow, and then the lab will determine which antibiotic is the bacteria sensitive to. So from there you can give your appropriate antibiotic. In the meantime, while waiting for your culture and sensitivity, you could give empiric therapy for a while. No? So hindi naman yung walang ginagawa sa pasyente while waiting. So what you can do is you can give empiric therapy for a while. As the results come in, or as the result would come in, then you would give now, or you would shift your antibiotic to the appropriate one. Ito. So sabi dyan, always check for consistencies with your result. No? So physical findings should match your chemical and microscopic results. So if you have a urine sample with plenty of cells, no, nakita nyo, you have lots of epithelial cells, WBCs, etc. So you should have plus for protein. No? So positive for protein. Higher specific gravity, because cells and proteins would increase, no, the amount of solutes present in your specimen. And your specimen should be probably cloudy or turbid. So things like that. You check for consistencies, no, before releasing your report. Okay, that's it, Pansit. Any questions? Any questions? Meron bang may question? Ilan kayo? 39 na tayo. You're 38, right? Tama ba?
37 po, Dok.
37? Eh bakit 39 tayo? 38 balik kayo nandito. May sobra. Si Dr. Santos nandito pala. Gulat naman ako. Kala ko. Anyway, sige. Present po. Okay. Any questions? Section B. Grabe, napagod ako sa renal physiology marathon. From 9 to 5, 9 to 4, 9 to sawa. Okay, sige. If you don't have any more questions,